Let's talk on Epstein-Barr virus, the hidden kissing disease. Have you ever wondered how something as simple as a kiss, sharing a bottle of water, or using the same spoon could pass along a virus that quietly lives inside the body for life? In a country like Nigeria, where our health system is already stretched thin, one virus continues to spread silently: the Epstein-Barr virus, EBV, also known as the kissing disease. Why we should pay attention? Nigeria already battles many health challenges, from malaria to chronic conditions like hypertension and diabetes. But one thing we often overlook is the silent illnesses that spread without much awareness. Money can buy cars, clothes, or houses, but no amount of money can buy back a broken body. That's why we must talk about EBV, a virus that quietly infects millions without them even knowing. What is Epstein-Barr virus, EBV? EBV was discovered in 1964 and belongs to the herpes virus family. Unlike malaria or flu that can be treated and cleared, EBV never really leaves the body. Once it enters, it stays for life. The first illness EBV causes is called infectious mononucleosis, commonly called mono or the kissing disease. What makes EBV tricky is that over 90% of people worldwide have been infected at some point in their lives. And in Nigeria, health experts believe the numbers are equally high, although many cases are not diagnosed. Why is it called the kissing disease? The name comes from the way it spreads. EBV is mainly passed through saliva. This means kissing, sharing cups, bottles, or straws, using the same spoons or forks, even droplets from sneezing or coughing. In rare cases, EBV can also spread through blood transfusion, organ transplant, or sexual contact. Signs and symptoms of EBV. The challenge with EBV is that its symptoms can look like other common illnesses such as malaria, flu, or even HIV. That's why it often goes unnoticed. Common symptoms include high fever, constant tiredness or extreme fatigue, persistent sore throat, swollen glands in the neck, loss of appetite, headaches and body pains, swelling of the liver or spleen in severe cases. Some people carry EBV in their body without showing obvious symptoms, but the virus is still there. The effects of EBV on the human body. At first glance, EBV may look like just another virus, but ignoring it can have serious health consequences. 1. Chronic fatigue syndrome. Tiredness that lasts for months, affecting daily life. 2. Liver damage or hepatitis, inflammation of the liver caused by the virus. 3. Spleen rupture, a medical emergency that can be life-threatening. 4. Cancer link. EBV has been linked to certain cancers such as Burkitt's lymphoma, Hodgkin's lymphoma, and nasopharyngeal cancer. 5. Weakened immune system, making the body more open to infections. Doctors often compare EBV's long-term damage to illnesses like HIV, because once your immunity is down, the body becomes vulnerable. Prevention. How to protect yourself from EBV. There is no vaccine yet for EBV, but we can reduce the risk of infection and protect ourselves by making smarter choices. Practical prevention tips. 1. Regular checkups. Don't ignore strange or prolonged symptoms. 2. Seek proper testing. Blood tests can confirm EBV if you feel unusually weak. 3. Avoid self-medication. Many people confuse EBV with malaria or typhoid and take the wrong drugs. Always seek professional help. 4. Don't share eating utensils, drinks, or toothbrushes. 5. Boost your immune system. Eat a balanced diet rich in fruits, vegetables, and water. 6. Rest properly. A stressed and tired body is more vulnerable to infections. 7. Maintain personal hygiene. Wash hands regularly and avoid unnecessary close contact if you are sick. My final word to you: once you discover you have EBV, remember, it is not the end of your life. With good rest, proper medical care, and a healthy lifestyle, most people recover well. Don't hide your sickness. Don't feel ashamed. Your health is your wealth. Once health is lost, no amount of money can buy it back. So protect yourself and your loved ones. If you ever notice prolonged weakness, fever, or swollen glands, please seek medical advice immediately. If you have any questions or want to learn more about EBV or other health topics, feel free to reach out. Remember, stay informed, stay healthy, because prevention is always better than cure. #HealthWatchHub, your health, your priority.